College students, people who write emails, people who work from home, listen up. I have a life. College students, people who write emails, people who work from home, people listen up. I have a life.
Good evening, everyone.
College students, people who write emails, people listen up. I have a life. I have a life.
Good evening, everyone.
College students, people who write emails, people listen up. I have a life. I have a life.
Good evening, everyone. Good evening, everyone, and welcome. My name is Khaira. I'm from Khaira Education. I'm absolutely thrilled to be connecting with you all today. Please introduce yourself in the comment section. Tell me your name, where you're from, and your profession. So for those of you who are joining for the first time, I'm going to give you a brief introduction. So I'm from Khaira Education, and Khaira Education is Asia's first premium provider. That means we were the first institution in Asia to be accredited by the OET Center. Talking about my background in OET teaching, I have been an OET trainer for nearly 7 years now. I have authored and co-authored 8 OET preparation books. Along with me at Khaira Education, I have an incredibly talented team of trainers with me, one of whom will be joining us today in this session. At Khaira Education, we've got a stellar success rate. If I'm sharing the Instagram handle with you, it's on the screen. Please follow us on Instagram, where we showcase our results, our student testimonials, and also guidance on OET tips and strategies from time to time. So if you're an OET aspirant, you will find this very useful. We offer a range of courses in online and offline format. For offline, currently we have presence in New Delhi, in Amritsar, and in Mohali. Very soon we are coming to UAE in Dubai. So please watch out the space for the starting dates. For online courses, we have trained students in different time zones in about 17 countries. And recently, we have also begun personal tutoring. So if you are repeating the test and are struggling with one aspect in particular, please reach out to us and we can tailor a solution for you. So joining me today is my colleague and a good friend, Sabreet. I will just let her in so she can introduce herself. Sabreet is a head trainer at Khaira Education Mohali. And Sabreet, would you introduce yourself?
Hi, everyone. I'm Sabreet. As Gurleen ma'am has mentioned, I'm the head trainer at Khaira Education. And we look forward to this session and to help you prepare for your speaking sub-test.
Fantastic. Thank you, Sabreet. I will take it on from now. Okay, so we have an exciting announcement for all OET aspirants. We've come up with this initiative on a Telegram. We've created a group for free OET tips, OET resources. It would include authentic practice tests, skill building lessons, lectures, and of course, we are present in the group to answer any queries that you have about your preparation or exam delivery. You can search by the name of Khaira Education OET Success Hub. And regardless of the profession, please feel free to join. I'm sure we'll be able to find the resources to fit your profession. All right. So if you see the picture on the screen, you'll see a doctor discussing the need for lifestyle modifications with a patient who has just been diagnosed with diabetes. Now, I want you to imagine that you are the healthcare professional in this scenario, and you only have a few minutes to prepare for this conversation. Think about what you would focus on when you're preparing yourself. What would you focus on what in what order the conversation should be like? What would be the aspects that you discuss and how you would go about the conversation? And while you're thinking about this, also think about what could happen if you were to enter this dialogue unprepared or without proper preparation. Let's ponder over it for a minute, and then you please type your responses in the chat box. Okay, I see some responses coming in. So how to start? And could you also maybe type some ideas about what you would focus on? Let's say, yeah, you familiarize yourself with the settings, how the patient must be feeling and how they're going to cope with this. So you generally be thinking about the patient's emotional state and how to address this in the conversation. Right. Okay, Pina, the patient may be confused. Yes, if somebody has just been diagnosed with diabetes, they would naturally have a lot of questions about what the treatment will entail. Okay, wonderful, Lisa. You've laid out a structure. Introduce yourself, how they've been managing, right. All right. So Thank you, everyone, for the insightful responses. I've jotted down some notes and we could go over this. So when you're preparing for this conversation, when you're going to speak with a patient who has just been given a diabetes diagnosis, one, we could think about what emotional state they would be in, right? So naturally, confusion could be one. They would have a lot of questions. They would want to know what the treatment will entail, whether uh, what sort of changes would it bring to their lifestyle, the treatment. Second would be they would be anxious. I think that's a very natural reaction. So, of course, when you're preparing to have this conversation, you should think about how you're going to address this during the conversation. So naturally, you would need to adopt a compassionate approach. The tone and the combination of words that you use should be reassuring, should be empathetic. And in contrast, let's imagine if this weren't to happen. Imagine where a health professional simply talks about uh, the lifestyle modifications but doesn't adopt a compassionate approach. What could happen in that case? So, in that case, it will affect the rapport. Obviously, the patient will not feel understood, they would not feel supported, it will affect the trust, and it will heighten the patient's anxiety, right? Which could affect the engagement, patient engagement in the proposed treatment plan. So it would lead to worse health outcomes. Similarly, another consideration when you're preparing for this conversation would be what kind of language to use. If you're going to talk about a medical condition, when you explain it to the patient, you should use language that is lay language, that is devoid of any technical jargon. If this is not done, if you don't think about it beforehand and uh, unconsciously, if you tend to use it during the conversation, this would leave the patient feeling confused and they would maybe end up with the after the conversation more confused than they at the start. So they would end up with more questions than answers. Another aspect that you could think about is the structure of the conversation, in what order the conversation would go. This is very important because you should allow patient enough time to process what you are sharing with them, what you're conveying to them. And this is a technique that some of you might be familiar with called chunking and checking. So you need to divide the information into manageable chunks and allow time for the patient to process this after each chunk, allow them to express how they feel about it or whether or not they have any questions. If this is not done, one, it will of course confuse the patient. Two, it could also lead to advice misalignment. So if you're not gathering the patient's perspective after your suggestions or after the proposed treatment plan, there is no way to find out whether or not the patient will be compliant with it. So this list, by the way, is by no means exhaustive list. These are some of the key considerations. I'm sure that we can think of other ideas as well. But the key takeaway from this discussion is that thorough preparation is crucial. It is very important for patient communication, for developing a patient rapport, for therapeutic communication, and of course, for best possible care for the patient. And as in real life, this is very important for your OET speaking exam as well. So the results, the outcome of the conversation would be dependent on the preparation that you undertake before the conversation. So that is what we're going to discuss in this lesson. We have divided this into two segments. First, we're going to discuss what you're allowed to do during the 3 minutes preparation time. And then we will have a section by section analysis of all the aspects on the role play card and discuss strategies and targeted insights for using this time optimally. So first, let's discuss what you're allowed to do during the 3 minutes preparation time. Number one, you're allowed to make notes on the role play card during this time, including key points to remember. You could underline anything that you find useful. You could write down some phrases or words or some useful reminders for yourself. This role play card would remain with you throughout the role play. So make sure that anything that you find would be helpful for you if you want to use a particular phrase, or if you want not to miss out on an aspect, make sure you write down a reminder for yourself on the role play card. Second, if you're unsure about anything, such as a pronunciation of a word or meaning of a word, you can ask the interlocutor for clarification during this time. Number 3, when the patient's name is known in the role play. So now, by now, some of you who are already preparing for the test, I think you're aware that no two role plays start in the same way. Each role play has a particular context, a particular scenario. And in some role plays, which start maybe after an examination or due in between the consultation, in those cases, or even a follow-up visit, in those cases, it is not necessary for you to ask the patient's name in the role play. In that, you can assume the name of the patient, or you can also ask the interlocutor during the 3 minutes preparation time what name they would prefer to be addressed by. So this is something that you can do in the 3 minutes preparation time. Okay, now let's come to the second segment, in which we will discuss all 3 sections in the role play card. The first is the setting. The second is the background information or the context statement. And the third are the tasks. And in the role play card as well, in the preparation time on the role play card, you should read them in the same order. So you start with the setting first, move on to the context statement, and then you look at the tasks. Okay, why is setting important? So there are these 2 questions that you should consider when you get the role play card, and during the preparation time, this is what you're supposed to think about. So 1, what is the nature of the setting? Is this an urgent setting, like an emergency department, or is the conversation happening in a routine setting, like a community health center or a clinic or an outpatient clinic of a hospital? So how this influences your conversation is that the nature of the setting it dictates the urgency. If it's an emergency setting, obviously the language, explanation, the talk will be very concise, because you would give precedence to the treatment, to the biomedical outcome. But if it is a routine conversation, patient engagement and rapport building would take precedence. So in that case, the introduction and even the conversation would be more detailed. The second aspect you should think about is, has the patient come into your workplace or have you gone into theirs? So different examples of settings where you were visiting the patient, a home visit, or you could be visiting them at their workplace. So let's look at some of the common settings that you get in the role play cards. So it could be a hospital emergency department, which could also be known as emergency room or accident and emergency. Then general practitioner clinic, doctor's clinic or general practice, home visit in a pharmacy, in a hospital ward, community health center, a nursing home or an aged care center, or a rehabilitation center, and outpatients clinic. And this list, again, it's not exhaustive. These are just some of the common settings that nurses and doctors would see on their role play cards. Now I've compiled a list with functions. If you want, you can take a snapshot of this slide, and it helps if you familiarize yourself with what is the function of the setting that you can commonly get in the exam. I'd like to discuss 2 examples of how setting can make a marked difference in the introduction statement. Now, if you see personalization in different settings, in a home visit, if the candidate is a nurse, they would introduce themselves like this. Good afternoon, I'm Nurse Gurleen, and I'm here for your scheduled home visit. Whereas in a hospital ward, good morning, I'm Nurse Gurleen, one of the nurses on this ward. So if you see both of these examples, they are tailored to the specific setting where you're working, which is given on the role play card. And make sure you do this. You should adapt your communication. You should adapt your introduction statement to the context, to the setting and the context given on the role play card. This would enhance the effectiveness of your preparation. Okay, here's a short activity. I'd like you to look at this setting and a sample response. Decide if the following introduction is suitable for its setting. And if you think it's not suitable, what would be a revised response to make it suitable for the setting? Okay, Sam, if it's not suitable, what is it that you'd like to change about this? Okay, Pratibha, if it's, so I see that all of you are saying it's not suitable, but could you type in a revised response? How would you change this introduction statement to make it suitable for the given setting? So the setting is home visit. Excellent, Maria. Yes, yes. I'm here for your scheduled home visit. Lovely. Yes. So why this is not suitable? Because it lacks personalization. It fails to acknowledge the home setting. I'm Nurse Maria, one of the nurses on duty today. It doesn't acknowledge the home setting, right? So this introduction, I'm one of the nurses on duty, would be more suitable for a place where there's more than one nurse. It could be a hospital ward or a clinic, but in this case, for a home visit setting, it's not suitable. So a better statement would be that I'm Nurse Maria. I'm here for your scheduled home visit. Okay, now let's come to the second section. That is the context statement or the background information. We're going to discuss the key questions that you must be thinking about during this time. First one is, who are you speaking to? Are you speaking to the patient themselves or a carer or a relative of the patient? This informs the tone and the content of the conversation. So we look at some examples, but this is something that you must be mindful of when you are preparing what to say, how to start the role play. So this would play a crucial role in that. Second, if you're speaking to a relative, what is their relationship to the patient? Are they a spouse, parent, or child? The third is this a new patient or a patient you have met before or a referral? How will this impact the start of your conversation? So in the context statement, you will find clues, whether you are meeting for the first time, whether the patient is returning for a follow-up visit, in which case, obviously, you would have met the patient before, or you would have the case history for the patient with some details, or whether the patient has been referred by another health professional. So whether it's a referral visit. So this information is mentioned in the background statement. So you should always pay attention to the level of familiarity. And this would dictate how your introduction statement, how your opening statement or dialogue would be shaped. For example, if you are speaking to a new patient, you would introduce yourself, you would ask their name, you would greet the patient properly, and then go on to the purpose of the visit. If it is a follow-up visit, you would not need to ask for the patient's name, right? In that case, you can assume a name for the patient and start your role play accordingly. Similarly, if it is referral, you can either confirm the name or you can assume a name and start accordingly. So the level of familiarity plays a crucial role in determining how you initiate your conversation. The next thing you should be thinking about What stage is the conversation starting from? Is this a first meeting? Is it a follow up? Or is it a post examination or post treatment role play? So sometimes in your role play cards, in the context statement, it is mentioned that you have just examined the patient, and then the first task would clarify what is it that you need to talk about. But in that case, you would not start with the greeting. Of course, if the conversation is starting after the examination has taken place, then you would begin accordingly. You would acknowledge that information, how you begin. So, an example for starting that role play would be, thank you for letting me examine you. So, when you see what stage the consultation is starting from, that will again shape, that will influence how you begin the conversation, how you start the role play. What is the reason for this conversation? What might the patient or the carer be expecting from you? Whether they're expecting a diagnosis, whether it's lifestyle modifications, a warning. So, depending on that, you would prepare yourself accordingly. Depending on that, we can anticipate what kind of questions the patient would have, what sort of emotional state they would be in, and we can prepare ourselves for how to address these questions or concerns as they come up during the conversation. The next would be, how might the patient or their relative be feeling? At times, you can find clues about the patient's emotional state, uh, an adjective like anxious, agitated, worried, or embarrassed, etc. This can be mentioned in the context statement, but even if it is not mentioned, it would be a good idea to put yourself in the patient's shoes after understanding the context. Try to imagine how the patient must be feeling and think of strategies of addressing that emotional reaction. For instance, if you are discussing diagnosis, like the first scenario we spoke about, if you are speaking to a patient who has just been diagnosed with diabetes, naturally the patient will be anxious. So you should think of reassuring statements. You should think of some ways you can reassure the patient without giving false hopes. You could also think of making them feel more comfortable, assuaging their concerns. You could think of some empathetic statements or some strategies by which you can put them at ease, put their allay their worries and fears. And the third aspect to consider here could be how you're going to uh, avoid overwhelming the patient when presenting with a large volume of information, right? So these are just three things that I could think of for the first scenario. Similarly, when you understand the context of the role play card, try to imagine how the patient would feel during the conversation and prepare yourself beforehand that the patient might feel confused. So I must make sure that I clarify enough times. I give them opportunities to ask questions. They might feel overwhelmed, they might feel anxious, they might feel agitated. And how am I going to address this? So, thinking about this beforehand would be a really good idea. And finally, always see if there are any medical or technical words that will require simplification for the patient. Now, what I would advise in this case is always check with the patient their level of familiarity with that word and then fill in the gaps accordingly. So you could always check with the patient, are you familiar with this word? If they are, check the current knowledge of understanding, and accordingly, you can tailor your content. Okay, we have a short activity. Now, you see the setting and context statement of a role play card. I would like you to identify the emotional cue as we spoke about in the previous section. So sometimes you're given clues about the patient's emotional state. Can you identify the emotional cue in the context statement for this expert? Uncomfortable. Very good. Yes, yes. Uncomfortable is the clue that's given here. He or she looks uncomfortable. Even if it were non-mentioned, you could imagine that a patient who is here discuss options for bariatric surgery, obviously this would be somewhat uneasy and uncomfortable for them. So to address the discomfort, you should think of a few reassuring, normalizing statements to put them at ease during the conversation. Can you think of a response as well? What kind of just give me a sample response for how you would put the patient at ease. If the patient is visibly uncomfortable, what would you say to put the patient at ease, to make them feel comfortable? Can you think of what to say to the patient? Yes, Sandhya. Sandhya has given fantastic response. Patient will also be curious. Yes. So you will need to make sure that when you're discussing the options, you provide ample time for the patient to clarify and ask questions so that there's no room for any ambiguity or confusion. Okay. Poonam says, I understand it must be challenging for you. Okay. Try not to worry. You're in good hands. It's understandable. Right, by reassurance, it's okay. So I'll give you a small OET tip. Whenever you want to reassure a patient, you can use normalizing statements. Normalizing statement is where you normalize their experience. So in this case, what you could say is that it's natural to feel uneasy. Anyone in your situation would feel the same way, or it's normal to be uncomfortable about this conversation, but let me assure you there are others who feel this way, and I'm going to guide you through all the options so you're well informed, and then we can take a decision together. So this would be one strategy, right? And the takeaway from this exercise is that whenever you're looking at the role play card during the preparation time, always try to see if there is a clue given about the patient's emotional state. Even if it's not given, try to imagine. Think of what the patient must be feeling and then prepare yourself for how you're going to address that emotional reaction during the conversation. All right, next activity. Now we're going to put whatever we've learned to use with this. I want you to type responses for how you will start this conversation. So you have the setting, hospital ward, the context statement is given. You're about to speak with the parent of a 16-year-old girl who has just undergone appendicitis surgery. The parent requested an update following their child's surgery. The surgery is successful, and you're here to provide an update and address any questions that they have. How will you begin this conversation? Okay, Mohammed. Everything went uneventful. Okay. Would you introduce yourself, and would you would you assume a name for the parent, or would you confirm it? How would you go about it? I would like you to think of how exactly would you start this conversation in the exam, and then type it verbatim. Okay, Maria, that's a good response. So yeah, you can confirm, you can introduce yourself and then confirm if it's the patient's mother, and then you can go on to convey that the surgery has been successful. So as if you were to imagine yourself as the parent whose child has just undergone a surgery, what would be the emotional state? They would be worried, yes, and they would naturally have questions about the next steps, right? So try to maybe frame a response that addresses both of these aspects as well. So you'll be speaking to a mother, to a mother who's worried. It's not explicitly mentioned here, but it's understood. A parent who's been waiting for an update and the child is in surgery, they would naturally be worried, right? So think of a comforting response, a supportive response, and you're here to talk about the next steps, which again would be on their mind. So you could outline the agenda, acknowledging this, that I know you're going to be eager to know about your uh, daughter's current state and the recovery, and I'm here to talk about it to you and answer any questions that you have. Lovely, Srijana. That's a great response. Yeah. I'm here to give you good news. The surgery went well. I know you must be worried. Let's talk about the next steps, and I'm here to answer any questions that you have. Lovely. Okay, the next activity. Look at this setting, which is a pre-operative assessment clinic. The nurse is speaking to a 45-year-old patient scheduled for knee replacement surgery next week. They are here for their pre-operative assessment today. The clinic has been extremely busy and you're running 30 minutes late for all appointments. The first task is to greet the patient. I want you to type how you would start this conversation, something to think about. Imagine if you were the patient who is here for a pre-operative clinical assessment. One, you would be somewhat anxious. You would want to, because if you have an upcoming surgery, it's natural, it induces anxiety. Two, if you have been waiting 30 minutes beyond your scheduled appointment time, how would the patient feel? Try to think of that and then frame your response accordingly. It'll be nice to see if your responses acknowledge these uh, emotional states. George says, okay, hello, thank you for waiting. Lovely. George, would you introduce yourself and would you check whether it's the same patient or would you assume a name? And if you were to assume a name, type your response as it is. That's a good response, Kritika. Well done. Good morning, Miss Sarah. I'm sorry for the delay in your checkup. Okay, great. I apologize for the inconvenience caused. Excellent, excellent. I see that you're apologizing or you're acknowledging that the patient has been waiting, and that's not a very pleasant experience to have. So, lovely responses. I apologize that we are running a bit late. Yeah, you could explain the delay as well. It says the clinic has been extremely busy, so you could acknowledge that hello, I'm Gurleen, one of the nurses in this clinic. I'd like to start by apologizing. It's been an unusually busy day for us and we're running late. I'm so sorry and thank you for being patient. Could I quickly check if you are so and so? You could confirm the name, right, to verify the identity, and then move on to the agenda. That I see you're scheduled for your preoperative assessment today, and then the conversation can proceed. Alternatively, you can also assume a name for the patient and you could start accordingly. Okay, the next activity, how will you start this conversation? So the setting is a general practitioner clinic. A patient returns for a follow-up after starting a new medication for hypertension. They seem concerned about its side effects that they're experiencing. First task is find out how the patient has been managing since the last visit. Okay, George, that's a great response. Yes, you can assume a name and you don't need to introduce yourself since this is a follow-up visit. So you could just start the conversation by saying something like, hello, John, how have you been since your last visit? Yes, yes, Mohammed, that's a good response. So how have you been doing with the new medication that I prescribed the last time? Would you mind telling me how you've been doing since the last visit? Good to see you again, John. Can you tell me how it's been going? Great, lovely responses. Yes, yes, these Poonam, that's a good response. It would be a good idea if you elicit this from the patient about how the medication has been, how their experience with the medication has been like. Uh, so a suitable response here would be that, hi, John, good to see you again. How have you been? Or how is the new medication working out for you? I think those would be suitable responses. All right, now from this point on, I would hand over to Sabreet.
Thank you, Gurleen, ma'am. Could you allow me to screen share? If you could just stop your screen share. Yeah, thank you. All right, everybody. So till this point of the session, you all have learned about the things that you're allowed to do in the 3 minutes of preparation time that you get during your speaking session for each of the role play cards. And then you have learned about how to deal or how to prepare for two of the sections of the role play card, the setting and then the background information. The third section that you have in your role play cards are the tasks that are listed for you. Those tasks are the cues for you to consider and then have the conversation with the patient. So on your screen, you see some key questions that you have to consider while you're preparing yourself for the tasks. The first question talks about what verbs start each task. As we all know that verbs are the action words. They tell you what action needs to be performed or what action is happening. So if you look at a role play card, all the tasks that you have listed after the background information begin with a verb. Those verbs are your cues on what you are to talk to the patient about. whether you're going to ask questions to the patient, whether you're going to give information to the patient about something, whether you're going to advise the patient about something, or probably explain the patient about something. So it's very important to identify the verbs that begin each of the tasks and accordingly prepare for the conversation that you're going to have. The second question is, how will you manage your time? There are a number of tasks on the card, and many a times you might not be able to complete all the tasks that are given on the card. And let me tell you very clearly that it is not a criterion for you, and OET does not assess you for the completion of tasks. So even if you're unable to complete all the tasks that are there on your role play, don't be worried. But since you have certain tasks and there's a purpose that you're having the conversation about with the patient, so it's important that you have a tentative idea on how much time are you going to spend on each of the tasks. Probably, let's say, if you have to introduce yourself to the patient and take the patient's introduction itself. So give yourself a tentative idea, probably I might need 30 seconds for it. And similarly, for other tasks, some tasks may require more time, some may require less time. So on reading the task, make a tentative plan on how much time are you going to spend so that you're able to at least cover most of the tasks that are there on the card and exhibit your speaking skills. The third question to cover and to consider is, how is the patient or their relative, if you're talking to them, going to respond to each of the tasks? Always remember that OET speaking is a two-way communication. It's not that you're there to give a speech, you give the speech and you come back. That's not happening. It's very similar to a real life situation. So you're going to have a conversation with the patient, and in the conversation, the patient would also be involved. So, to every question that you pose, to every statement that you make, to every explanation that you give, the patient is definitely going to have a response. So, it's better to always anticipate whether the patient is going to agree with you, is not going to agree with you. Probably the patient would be uncomfortable. We saw in one of the cards, they've come for a discussion, but they seem to be uncomfortable. So, you have to pick up those quick cues and anticipate the patient's response, and accordingly prepare in advance about those responses as well. And finally, if you get the chance to, and if there be time, if you have to close the conversation, how do you plan to do that? So it's better to prepare keeping all these questions in mind while you're reading the role play cards task section. Okay. Now, to begin with, let's talk about the verbs. On your screen, you see some verbs on the left-hand side. They are ask, find out, explore, inquire. These verbs are mostly related to gathering information because all these verbs indicate that you have to ask questions to find out information from the patient, to gather information. If the task begins with the verb ask, it indicates that you'll have to request for specific details. For example, if the patient informs you that he smokes every day and you want to get specific number of cigarettes that he smokes every day, so you'll have to ask a question. May I know the number of cigarettes that you smoke? And then the patient would give you the information. Find out also indicates that you have to ask questions. For example, you want to get information about the lifestyle habits of the patient. You want the patient to speak about the kind of day that they have, the kind of activities that they do. Could you tell me about your lifestyle habits? Is a question that you could ask to find information about what kind of lifestyle the patient has. Explore. Explore is a verb which indicates that you do have some information, but you want to get deep into it. For example, if the patient tells you, I do exercise sometimes, so you want to explore that a little more and you want to know exactly how much of physical activity is the patient doing. So you could ask questions. Could you tell me how many times a day do you work out? How many times a week do you exercise? So that gives you more information about that particular topic of physical activities that the patient is involved. And finally, the verb that you have on your screen is inquire. Again, you have to ask questions to seek information, again, related to any of the habits, any of the practices of the patient, any medicine that they've been taking. So all these 4 tasks would indicate that you have to prepare yourself to ask questions. So you should be ready on what kind of information you need from your patient and what kind of questions would you want to ask in order to get that information. Now, this list on your screen is mostly related to giving information. The first verb, however, confirm, will also make you ask some questions. Now, when do you confirm? When you already have some information. Either it is given on the role play card or the patient has told you about it. So you just when you want to check whether you and the patient are on the same page or whether you have understood the patient correctly, you ask a question to confirm. Usually, this question is a close-ended question, a yes or no question. For example, you can say, I can see on your case notes that you have had high blood pressure for the last 3 months. Is that correct? So you're confirming whether what's mentioned on the case notes or the information that you have got is actually true or not. The next verb says explain. Many times you would see that there are lengthier points on your role play card, or there is some information which the patient is not very familiar with, which is very new for them and is a little complex. In such cases, you will have to break the information down. You can probably use the skills of chunking and checking. We'll discuss it in detail in the latter half of the session. This means that you give the information in small chunks and you check whether the patient has got the information that you're trying to provide. So in order to provide clarity to the information that you're given, you break it down for the patient, any complex piece of information or any lengthy piece of information that you're given. Outline is just to give an idea. So whenever the task begins with the verb outline, it means that you have to give the idea to the patient. For example, the patient has just come to explore the treatment options available, and one of the treatment options is surgery, and they want to get an idea about it. So you'll have to outline the major points or steps that are involved in that procedure. For example, you could categorize by saying, firstly, you would be sedated, following which the doctors would perform the surgery, and then you will receive follow-up care in the recovery room. So what are you doing in this case? You're giving an idea about the procedure. You're not giving the details or what would be included in the sedation or what would be included in the surgery. Some were, I mean, usually when you're talking about lifestyle habits or when you are to teach about a particular procedure to the patient, the verb educate is used in the cards. For example, there could be a patient who has diabetes for the last few years, has not been able to manage it properly, and you need to teach the patient on how to administer insulin. So you break it down step by step for them. So you can probably say, uh, firstly, it is important that you clean or you sanitize the area of your skin where you are to administer the injection. And the next step is to fill the injection with the insulin solution and then administer it into your skin. So you break it down for them, you're educating them that they have no knowledge about it. So you have to teach them on how the process is to be done. The next verb that you have on your list is advise. Advise, recommend, suggest. These are very close to each other, these 3 verbs. Whenever you provide recommendations, give suggestions to the patient about something, or you give them idea on something that can possibly help them, in all those cases, these verbs are used. It is very important for you to be careful about the patient's perspective when you're giving the suggestions, because one of the criteria which is going to assess, which you'll be assessed in your speaking sessions is understanding and incorporating the patient's perspective. You cannot force your suggestion onto the patient. Always remember that you will have to keep the patient's perspective, their thoughts, how do they feel about a particular thing in mind when you're giving them suggestions. Just like in the previous activities, you considered the cues that were given about the patient's feelings to you in the cards. So similarly, when you're giving suggestions or recommendations, keep them in mind And many a times after giving a suggestion, it is advisable that you check whether the advice is okay for the patient. For example, if you have asked a patient to cease smoking, so you can check with them. Do you think that would be possible for you? Would you like to consider it? So check whether the suggestion that you've given is actually feasible for them or not, or whether they agree to follow that suggestion or not. And if not, probably you can come up with another suggestion for them. Another verb that we need to focus on in this part is the verb encourage. Now, people have lifelong habits, and I mean, you all have been in conversation with patients every day. Patients many a times are not very readily uh, they do not readily agree to the suggestions that you give, because probably they have some lifelong habits which are difficult to get rid of. So in such cases, you need to encourage them. Let's say if a patient is not ready to quit smoking, the smoking patient that we have been talking about, so let's say the patient is not ready and refuses to agree. So you can encourage them. It would be a good idea to give it a try. Will you be able to do that? So you're encouraging them that at least they should try. And if it does not work out, there is another way that can be found out. The final the verb that you see on your screen is warn. Please remember, warn is not equal to scare. You are in no way going to scare the patient. You're just going to very tactfully warn them. For example, if you had given some suggestions to the patient earlier, the patient is not following them and has come to you for a follow up, reporting that his condition is not improving, or refuses to follow a suggestion that you've given, then you can use the possible risks that are involved for not following that suggestion, or probably the dangers that or the consequences, adverse consequences that would be there if they don't follow the suggestions. But you have to be very careful and very tactful here. You cannot scare the patient. Probably a statement like, I understand that you would not want to quit smoking, but if at this stage you do not quit smoking, your health may start deteriorating, or your condition may worsen. So you have to give them um, a risk that can push them to follow the advice that you're giving. But in no way are you going to scare them about that. If you don't quit smoking, you may die. Something like that, we are never going to say to the patient. We have to be polite and mindful that it's just another human being who has some limitations, who has some habits which which it is difficult for them to get rid of. So these are another list of verbs that you very frequently see on the role play cards. And now I have to find a list. Okay. The first verb on this list is persuade. Now in this case, I guess Colleen ma'am was talking about it earlier. The skill of labeling can help. Many a times, I mean, the patient is not ready to accept. In such cases, it's important that you use words like important, imperative, significant. For example, it's significant for you to get rid of this practice right away. So, and also you can probably use their perspective while you're persuading them. I know it is difficult for you to get rid of this lifelong practice, but it is imperative that we try getting rid of it right away. Otherwise, it might have certain consequences. So, what have we done? We have utilized the patient's perspective, we have persuaded them, and we've also warned them a little that it can have certain consequences. Reassure, again, a verb that did come earlier as well. So, normalizing the situation for them. Most of the patients that come to you are concerned, they're worried, and you are there, and you are their hope. So they come to you with certain hope. So it is important that you address their concerns, you understand what they feel, and you provide them some comfort with statements. For example, if a mother has brought her child and the child is unwell, so statements like, I know that as a mother, it must be very difficult for you to see your child in this condition, but don't you worry, your child is in the right hands. Statements like this this would pacify the mother, and she would be in a little comfort as compared to the condition in which she has come to you. Empathy is a very important aspect in your role play. I mean, you've had many sessions on OET All Stars related to it. And it is very important that you keep this skill or in your mind all throughout the session. I mean, from the beginning till the end. It's not only that when you have got the word empathize, it's only then are you going to empathize with the patient. Empathy needs to be there all throughout. But when this verb crops up on the writing task, um, you will have to be very careful that in this case, you have to be ready that the patient is going to be, let's say, a little overwhelmed. The patient is going to be a little concerned. So you have to have your empathy phrases ready while you're preparing. So you need to be ready to have some empathy phrases and to speak to them to the patient. So this gives you a cue that the patient is going to be overwhelmed or concerned, and you'll have to be ready to have some empathizing statements. I'm sorry for repeating that. For example, let's say, I understand it must be very difficult for you to be waiting here for the last 30 minutes. But let me reassure you that the doctor will be here soon to take care of you. So in this case, you've understood the concern of the patient. You've understood that it's difficult for them to wait for 30 minutes. And you understand what they are feeling. Emphasizing when you have to highlight or stress the importance of a particular point that you have told the patient about, you use the skill of labeling by saying it is imperative that you follow the advice that the doctor has given. It is important for you to adhere to the medication plan that the doctor has given to you. So, words or phrases like this can highlight that there is something important that the patient has to follow or about what you have said to the patient. Justification. Now, you might think about what justification you had to give to the patient. Whenever you tell the patient about something which is not in agreement to what they expect or which is not in alignment to what they are saying, you have to have a reason to give them so that they understand from which point of view are you speaking. For example, if you are talking to a patient and the patient says, um, and you're a nurse, and the patient says, I'm not going to wait for the doctor. You give me the medicine right away. In such cases, what you have to do is you have to have a respectful tone and you have to give the reason to the patient. I understand that it's difficult for you to wait for the doctor, but as a nurse, it is out of the range of my jurisdiction to prescribe your medicine. So it is advisable that you wait for the doctor. So you have not changed your tone. You have been kind to the patient. You have understood the perspective of the patient, yet you've justified yourself. And this is in close connection to declining, the next verb. In most cases, when you decline the request that the patient has, it's only then that you justify. For example, the patient wants his or her friend to be there when the procedure is being performed. So you can very politely say that I know you need the company of your friend while you are in the difficult situation of undergoing this procedure, but I'm sorry, it's against the hospital rules. We cannot allow your friend to be there in the procedure room. It is better that your friend waits outside in the waiting area. But let me reassure you that I'll keep her or him updated about uh, your condition. So in this case, again, you have you have denied what the patient requested for, but you were empathetic. You considered the patient's perspective and you were polite. The second last verb on your list is resist. Again, this is close to declining. Let's say you've declined and the patient still says that I would want that my friend be here with me during the procedure. So you gently and very politely, you would have to refuse that I'm really sorry. I know that you want this, but again, it is against the hospital policies and I cannot I cannot help you in this. I would not be able to allow your friend the procedure. So decline and resist are, decline is when the patient requests something. And again, if the patient requests for that, or the patient is very adamant that they want something, in that case, you will also have to show your resistance and clearly refuse that you cannot accept their request. And finally, address. Address, I think, is not only in the whenever the task begins with address, obviously you'll have to address the concerns, the questions, and the emotions of the patient. But apart from this as well, all throughout the card, you will have to be careful about addressing everything that the patient has to speak to you, addressing all the concerns that they have, and again, having a cue on how they might feel emotionally, and then addressing it politely, taking care of it, and using statements that can provide them comfort. So all these verbs are very significant in, I guess, moving your conversation forward. And so that the conversation's flow remains intact and you just don't stop in between and think and read the card and then speak. It's very important as you're allowed to mark on the role play card to underline these verbs so that you just have a glance at the underlying verbs and you know what's the next step that you have to take, what's the next statement that you have to speak. I know I've given you a lot of information about all these verbs. Let's do a small activity. Okay. On your screen, on the left-hand side, you see 4 verbs. And just a minute, I think. I'm sorry for that interruption. Yeah. On the left-hand side, you see some verbs, 4 of them. And on the right-hand side, you have the actions. Now, these actions are not in correspondence to the verbs that they are in front of. For example, advise patient about surgery. It's not in correspondence to that. So what I want you to do is I want you to match the verb with the action so that you know what action is to be performed, what that verb indicates. I would like to see your responses. Let's go with the first one. What do you think is the answer for the first one? A, B, C, or D? You can put your responses in the comment section. Okay, Navneet says D. Kirtana says D. Rahul D. Deepa D. Okay. Okay. Most of you are saying, okay, we have C as well. Rahul says C. Sri says, Lija says C. Okay. All right. Okay. Many of you said D. Many of you said C. Advise self-care, keeping the wound covered, topical ointment, avoiding prolonged sun exposure. Don't you think there should be a word after it? Advise about, probably, about self-care, but the about is missing. So, yeah, the other response, C is absolutely correct. Advice against the use of ill-fitting footwear. You don't want the patient to wear footwear that don't suit them. Similarly, let's find for the second one. What do you think for the second one? 2? Is it A, B, C, or D? Correct. 1 is C, absolutely correct. 2A. Okay. 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 We're looking for 2. Explain. What do you think is to be explained in this? What do you think the patient will not be aware of? Remember, explain is to give information about complex things patient might not be aware of, needs simplification. Uh-huh. 2D, right. Some of you saying B, A, D. Great. For all those who wrote D, it's absolutely correct. Explain self-care. There are so many things that are to be covered in self-care. Keeping the wound covered, topical ointment, avoiding prolonged sun exposure. All right. I can see the responses for 3 also coming in. 3, inquire. Remember, it was in the first slide of verbs. Information gathering, asking questions. What do you think are you going to inquire about? 3, great. Okay. Right, 2D, absolutely correct. We are now looking for responses for 3. Good, Jilson. 3C. Rahul as well. Aparna. But see, we have already written for number one, advice against use of ill-fitting footwear. What are you going to inquire about? What do you want to know about? What do you want to ask questions about? Lovely. Ruchi says B. Tanya, B. Kainat says B. Absolutely correct. If you're asking questions, you will ask about the questions, about the symptoms that they're experiencing, what they're feeling. So, right, inquire is about patient symptoms. Absolutely correct. And finally, for number four, what do you think? Reassure. What are you going to reassure the patient about? What is the patient going to be concerned or worried about? Mm-hmm. 4A. Good, Ebinyo. Aparna says A. Right, lovely. Tanya says A. Avi says A. Deepa says A. Navneet says A. Lovely responses. All of you got it correct. Great. I'll show you the responses on the screen as well. Just a second. Advice against use of ill-fitting footwear because the patient is wearing it. So you're going to advise them to not advise the patient to not do that. Explain about self-care. So you'll have to break it down to the patient on what needs to be done for wound, what needs to be done for the ointment, and so on and so forth. Inquire, you're going to ask questions related to what the patient has been experiencing till now. And reassure, because the patient must be worried about the surgery. If we anticipate the thought of the patient, so you're going to reassure about it. Lovely, everyone. Thank you for your lovely responses. Okay. In the next section, I have a mini role play card for you, an excerpt from a role play card. In this case, you have to do some prediction. You have a card, and in the card, you have the background information, the setting, and just one task. We have done the verbs. Based on this statement that's mentioned in the task, you have to predict on what the patient might be feeling. How do you think the patient might be feeling? And how do you think they would be responding to this? The patient is a long term smoker who is presenting with complaints of fatigue and breathlessness. And the task that you have is encourage the patient to consider a smoking cessation program. So you have to encourage the patient to join this program. What do you think could be a possible? I mean, how do you think the patient might feel? And to this suggestion of yours, how do you think the patient is going to respond? What do you think? Are they going to accept it? Not readily accept it? Reluctant? They could be reluctant, correct? Srijana, absolutely, I agree with you. I suspect the same. Others, what do you think? Mm-hmm. Reluctant? Right. I do agree that the patient would be reluctant in this case because he's been a long-term smoker. Now, you already have predicted the patient is going to be reluctant and you have to encourage the patient. Could you put a statement in the comment box on how are you going to approach this patient? Or what statement are you going to give to the patient? How are you going to encourage the patient when you give this advice and they're not ready to accept it? What are you going to say? Absolutely, you're all agree. I agree. Unwilling to do it, probably reluctant, hesitant to agree. Correct, correct. So, how are you going to tackle this situation? What possible response are you going to give to this patient on their reluctance? Mhm. Right, the patient might deny. So, what statement? I mean, when you're in the speaking session, having a conversation with the patient, what exactly will you tell the patient? You can type it in the chat box verbatim. Very good, Poonam. I can sense that it must be challenging for you. Lovely. Good, Jaspreet. I understand it's quite difficult to, but it's imperative to deal with, but it's imperative to stop smoking and to improve your health. Great. You've used labeling in this case. You've used the patient's perspective. Lovely. Lovely. I'm sure it must be very challenging to accept the suggestions, but you're willing uh, to at least reduce the number. Yeah, it's rather than you are willing, you can give this a suggestion that it must be challenging for you to accept this, but it is beneficial for your health, or at least we can start by reducing the number of cigarettes that we smoke. That could be another response that you can. Good. I completely understand that it must be very difficult to cut off your smoking or to cease your smoking. But if you do not make a change on this, it may lead to health risks. Okay, so you're warning the patient. Makes sense. Good responses, lovely responses, everybody. I think I agree with all of you. So one of the way could be, I know, Kim, that it must be difficult for you to quit a habit that you've been practicing for so long. But at this stage, I think it is significant that you joined a smoking cessation program so that you can reduce the number of cigarettes that you consume and eventually cease smoking. I can see the responses. Great. Everyone, very good. Okay, let me give you another situation. In this situation, your patient is 28 years old and has been experiencing chronic gallbladder pain, and along with that, inflammation. You've just finished examining the patient. Findings are indicative of gallstones. And you are talking to the patient, and the verb that you have is recommend. Recommend cholecystectomy. It's a surgery to remove gallstones. It's an outpatient procedure, laparoscopic technique, quicker recovery than traditional surgery. How do you think the patient is going to respond when you tell them that they're going to undergo a surgery and that the findings are indicative of gallstones? Mhm. What do you think is going to be their response? How are they going to feel? How would somebody feel when you tell them that they have gallstones and they have to undergo a procedure? You have to analyze or anticipate what could be the patient's response to this. Anxious, yes, because that's something big that's going to happen. A little scared, probably. Yeah, scared, worried. Yeah. The patient may have reluctance, Kaitana says. Great. Anxious, worried, anxious. Yeah, worried, anxious, concerned, because this is something huge that's come up their way. So they could be a little concerned and worried, frightened, probably a little scared on what's going to happen. So, how would you now you know you've already anticipated this? So, how are you going to prepare yourself for the recommendation? How are you going to begin the statement of recommending to the patient that they have to undergo the surgery? Can we have some statements for that? Let's see. Sad, overwhelmed, right? These are the feelings that the patient may have. I absolutely agree. Now, how are you going to prepare yourself? Give me the statement on what you're going to tell the patient when you know that the patient is going to have such a feeling. Right. The patient might say, is it necessary? So what are you going, how are you going to recommend it to the patient? Mhm. Mm-hmm. I understand that you've been dealing with the pain for a long time. Would it be okay if I discuss possible management options with you? Right, when you tell them that it's gallstone, so yeah, they would want to know the management. Based on your condition, I believe that it's the most beneficial choice for you as it's a laparoscopic surgery, which is known to be fast and needs less recovery time. Very good. Mm-hmm. Shrikant, how about we be a little considerate to the patient? This is a great statement, but do consider that the patient would be very upset to know that they have gallstones. So probably some empathy can be shown here, probably that your findings are indicative of gallstones. I know it must be a difficult situation for you, but don't you worry. We are here to discuss the possible options to manage the condition. Or I'm sorry to inform you that your findings are indicative of gallstones. I'm recommending cholecystectomy, but you don't have to worry for this because it will be done by laparoscopic technique. Right, absolutely. I agree with all of you. So yeah, Aparna, we can normalize the situation, correct? We could probably, a possible example could be, I know, Martha, that it is a difficult situation for you, but don't you worry. We'll discuss some management options. I would suggest that you undergo a surgery for the removal of gallstones, which is called cholecystectomy. For all of you who've written cholecystectomy in the comment section, remember it's a medical terminology. The patient does not know about it. So there are two ways of going about it. Either you first explain what it is and then you say it is called. For example, I would recommend that you undergo a procedure for the removal of gallstones. It is called cholecystectomy. Or I would recommend that you undergo cholecystectomy. Do you have any knowledge about it? So you check the prior knowledge of the patient regarding the term, or you simplify the term and then introduce the term to the patient. Because if you say cholecystectomy directly, that could be a difficult situation that would become more difficult for the patient. First, to be in a situation where they have to undergo the procedure, and second, to understand the term. Right, lovely responses, everybody. So that we can simplify it for the patient, I have a task for you. On the left hand side, you have some words which very frequently are used in your role play cards. For example, anticoagulant, hypertension, hyperlipidemia, dyspnea, echocardiogram. Now we're going to simplify these terms for the reader. How about the first one? How would you give the information about the first one to the reader? What do you think is anticoagulant? How will you simplify it to the patient? My bad, not the reader, but the patient. You're talking to the patient, they don't understand what's anticoagulant. How will you simplify it for the reader? A blood thinner, a blood thinning agent, probably, or a medicine for absolutely. You've all written blood thinner. I agree with you. A medicine for thinning the blood or a blood thinning agent, a blood thinning medicine. Absolutely. How about hypertension? Blood blood pressure? Blood pressure is not hypertension. Navneet, I want you to add an adjective to blood pressure. What kind of blood pressure is hypertension? High BP, Pratibha. High blood pressure, high BP, high blood pressure, all of you. Absolutely. How about hyperlipidemia? How do you simplify hyperlipidemia for your patient? High level of cholesterol in blood. Good. How about we simplify high cholesterol a little more? Cholesterol also, I mean, not all the non-healthcare professionals or patients would be aware of it. High cholesterol, high fat levels, right, correct. Elevated amount of fats in blood, right, Rahul? Lipids would be, I mean, not so suitable because lipids, again, the patient may not be aware. Cholesterol, maybe, but fat levels, excess level of fat, correct. All of you are correct. Great. How about dyspnea? High fat levels, right? How about dyspnea? Difficulty in breathing, Pratibha? Shortness of breath, correct. Difficulty in breathing, shortness of breath, great. And finally, echocardiogram. How do we simplify this for the reader, for the patient? Mhm. Procedure to check the activity of your heart, test to check heart's condition, ultrasound of, for the heart, PCO plus clinic, somebody said, yeah. Video imaging of the heart, correct. Ultrasound of the heart, video imaging of the heart, visualizing the heart problem, correct. So we do have the responses, anticoagulants, you were all correct. Blood thinners, medication that helps in preventing blood clots. High blood pressure is hypertension. Higher than the normal fat levels or high amount of fat levels in the blood. Difficulty in breathing. Great. Lovely responses, everybody. Great work you all are doing. Okay. Now, let's learn some of the techniques that we can be in advance, in advance be ready for a particular task. Remember when we were doing the verbs, I gave you chunking and checking. I told you labeling. So we'll discuss those techniques and you're going to tell me which technique are you going to be ready with if you have to deal with a particular task. For example, on your screen, you have two techniques, chunking and checking and cone technique. Chunking and checking is a technique through which you give the information to the patient in small parts, small chunks, and you check with a question whether you and the patient are on the same page or whether the patient is in agreement to the information that you have given. So when you give complex or lengthy piece of information, by breaking it down and then checking whether you're through with the patient with it, it's called chunking and checking. And then you have cone technique. Cone technique is a technique of asking questions in which you first ask open-ended questions, questions which have lengthy answer, which gives the patient the opportunity to speak. And then you move on to close-ended questions, questions which have a yes or no answer or a one-word answer. So the situation that you have is your patient is a 28-year-old man or woman who's been diagnosed with hypertension. The task is find out about the patient's current diet. So you underline find out and you decide which technique will you be using when you have this task to be performed with the patient or to be have when you're having conversation with the patient about this task. Will you be using chunking and checking or will you be using cone technique? Type your responses in the comment section. I can already see some coming up. Nikhil says cone technique. Mm-hmm. Nikhil is also giving us example of the question. Good job, Nikhil. Shri says cone, Richa, Pratibha, okay. Aparna says, Uwe says, great. All of you have done an excellent job in identifying the technique. We'll definitely use cone technique because cone technique is to ask questions. And when we discussed the verbs, we discussed that find out is to ask questions. So you're all absolutely correct. Correct. You're also giving me the questions. Lovely. Tell me about your diet. Great job, everybody. Okay. The next situation that you have is that your patient is a 28-year-old man or woman who has been diagnosed with hypertension. The task in this case is emphasize the importance of low sodium diet. Now, the two techniques that you have are labeling and signposting. Labeling, as we discussed a little earlier as well, is to highlight something, to stress the importance of something. While signposting is when you introduce a new topic in the conversation, when you move from one topic to another. What do you think? In this case, which one is more suitable? Labeling, to stress, to highlight, or signposting, moving from one topic to another, using a phrase to introduce a new topic in the conversation? Mm-hmm. Sure, Kelly. A cone technique is a technique in which you move from open-ended questions to close-ended questions. Open-ended questions to gather more information, close-ended questions to get specific details about the patient. Labeling, all of you are saying for this card. Lovely. Amazing. Correct. I would agree because we are emphasizing the importance of a low sodium diet. Now, in this one, could you also try writing the statement? How would you emphasize the importance of a low sodium diet to the patient? How would you stress the importance? Could you think of a statement that you could give to the patient using the labeling technique? Okay. How about Namal? How about we have a positive statement instead of I can't stress how important this is. Let me stress this is very important for you. Let's see others. What are your suggestions? What statement are you going to give to the patient? It is imperative to maintain a low sodium diet in this condition. Excellent. It is imperative for you to consume a low sodium diet. It is important for your health that you take a low sodium diet. Somebody wanted examples. So these are all examples of labeling. It is significant that you take a low sodium diet at this point so that your health improves. This could be another, just another example of how you could present the information to the patient. Great. All right, the final card on your screen, the same patient, but this time the task that we have is recommend lifestyle modification, balanced diet, stress management techniques, regular exercise, limiting alcohol intake. Which technique will you use? Chunking and checking or cone technique? Oh, great statements coming in the chat box for the previous card. Thank you. Lovely responses, everybody. How about this card? Chunky and checking or cone technique? Uh-huh. Chunking and checking, says Poonam. Rahul, Srijana. Mm-hmm. Kainat says chunking and checking. Most of you believe it's chunking and checking. Great. Right. I agree. It's chunking and checking because you're going to give information to the patient in this case and not seek information. So you would not be asking questions using phone technique. All right. Can anyone give me an example of a chunk that probably you would be using to give information? Let's say, let's not discuss all of them. How would you recommend balanced diet? Just a chunk, an example. Okay. Nikhil says, okay. Rather than asking a question, Nikhil, give the information and then we'll check. I would suggest that you take a balanced diet. Will it be possible? Is the checking question. Good. I would recommend some lifestyle modifications. To begin with, you need to take a balanced diet. That's a good chunk. And then we can ask a question along with this chunk. Will it be possible for you? Will you be able to do that? So you check whether the advice that you've given to the patient can be followed by the patient or not. So that you and the patient are both on the same page, it is important to always check with the patient about the information that you've given. So all the strategies that we've discussed till now related to verbs, simplifying the language can help you in order to be ready and prepared for the card or for the conversation that you're going to have with the patient a little more. And finally, many a times you might not get the opportunity to wind up your conversation because it's not important that you cover all the tasks in the 5 minutes of time, and sometimes it's not possible to cover all of them in the 5 minutes of time, but most of the times you do get the opportunity to close the conversation. So when you do get the opportunity to close the conversation, how do we do it? It's better to be prepared about that as well. First, you can ask the patient at the end of the conversation if they have any questions or final concerns that they would want to discuss with you. So, probably, do you have any final questions before we wind up the conversation? The second is using the teach back method. Now, this is a very interesting method. You have the conversation with the patient, you give a lot of information to the patient. Sometimes it is better to check with the patient if the information that you have provided to them is the same information that you gave, so that you check whether both of you are on the same page. You could always request the patient, would it be possible for you to repeat the information that I've provided to you in your own words? This way, you would also know, and the patient would also know, that whatever information you both have communicated to each other is the same. Third, summarizing the key points. Another way of winding up the conversation is you doing the summarization part, which means, for example, the patient came to you with certain complaints. You have addressed the complaints and you have given some suggestions to the patient. So it's a good idea to summarize the key points of the suggestions that you've given to the patient at the end of the conversation. It's a good idea to end the conversation like that. And finally, sometimes it could be that you have follow up with the patient in the future, or there are certain steps that are to be followed in the future. So you can set up the next stages on, and also if you're going to see the patient again and if you're going to be available for the patient in the future, it's important that you reinforce that if there be anything, they can contact you. So your availability for ongoing support can be exhibited at the end. So this is another way of finding up the conversation, that you can come for you have to come for the follow-up on 23rd of the next month. But if there be any questions or concerns that you have before that, you can always consult. So you can use any one of these four according to the situation in your card, and you can wind up your conversation. It's always good to wind up the conversation if the 5 minutes of time is not up, and just not leave it at the end open-ended. It's good to wrap up the conversation. I mean, that is what we do in real life situations as well. We just don't leave any conversation with. So you can use these and wrap up your conversations. These are the skills, these are the techniques that can help you to prepare for the writing, for the tasks that are mentioned on the role play card. I now have an excerpt from a role play card, and we'll try to together prepare for it. The setting that we have here is of the general practitioners. So it's a general practice. A nurse or a doctor is the healthcare professional and is speaking to a 45-year-old patient who's presenting with complaints of dizziness, fatigue, and leg pain. You have examined the patient, and the results indicate high blood pressure and elevated cholesterol levels. The two tasks that you have are: number one, give findings of your assessment. So you inform about the assessment that you've done. Respond to the patient's questions. Obviously, when you inform, there could be some concerns that the patient may have, so you'll have to respond to them. And find out about the patient's lifestyle. Emphasize the importance of lifestyle modification. Let's take it step by step. It's a general practitioner's clinic, and you are speaking to the patient whose examination you have already done. So what do you think? You'll have to introduce yourself and take the patient's introduction. You can type yes or no in the comment section. No, right. You would not have to, because you've already done the examination. The conversation is not starting from the beginning, it's a midway conversation. Okay. Then you have to give findings of your assessment to the patient. So you'll have to have an anticipation on what do you think the patient is going to feel when you give them the information about the assessment. Respond to the patient's questions. So you'll have to be prepared on the kind of questions the patient is going to ask. You will have to be prepared on the kind of response the patient might have when you inform them of your findings. So you'll have to be prepared about this. Then find out about the patient's lifestyle. Find out, we already know, is the verb phrase that tells us that we'll have to ask questions. Emphasize the importance, which means we'll have to highlight that they'll have to make the modifications. Okay, all right. Let's decode the thought process that would go into the preparation of this card. So, since no need of introductions, you can assume the patient's name, let's say John. The patient must be feeling anxious and worried. Remember, I told you to anticipate how they must be feeling because they're waiting for the test results. So, a statement like, a little sensitive statement like, I can understand that it must be difficult for you to wait for your test results because the feeling could be unsettling on what could be the results. So you be a little sensitive, a little reassuring while you begin the conversation. And then task one wants you to give the information about the assessment. So in this case, since you're talking to this patient based on the symptoms and assessment, it's good to relate the symptoms that the patient is experiencing and then in clear and simplified language, explain the diagnosis to the patient or explain the findings that you have. For example, that your test results indicate high blood pressure and elevated amount of cholesterol level. This could be the cause that you're experiencing fatigue, dizziness, but please try not to worry. These are common conditions or common symptoms, and there are many effective ways of managing them. And then you encourage the patient because remember, you have to respond to the patient's concerns. So you encourage the patient to share their concerns with you. Please feel free to ask any questions or share any concerns that you might have. So the patient would verbalize their concerns with you, and you already would have anticipated that the patient could be concerned on how to manage, what to do. So you would handle this conversation, this part of the conversation tactfully, and you would reassure them that there are there are various ways in which this condition can be managed, and that way you would be introducing that they would have to make some lifestyle modifications. But before giving the suggestions, I need to know a little more about your lifestyle. So you would ask the question, could you tell me about your lifestyle habits? So you're finding out the information. And once you have the information, accordingly, you suggest the modifications that they have to do. So it's a step-by-step decoding of the role play card and preparing for what the patient might say, what we have to say at every stage. All right, great. That's a good response, Rehan. Lovely. Now I have the role play card for you. We'll read the role play card and step by step, we would try to decode it on how we would prepare for each part of the role play card. You're speaking to a 50-year-old patient experiencing worsening chronic knee pain. This is a follow-up visit, and the patient was prescribed pain relief medication during the previous visit. What do you think? Are you again introducing yourself or not? Will you be introducing yourself in this case? No. Good. No. Now, the cue in the role play card's background information is that it's a follow-up visit. And the patient was prescribed pain relief medication during the previous visit. So you already have the information that the patient has come to you earlier. This is not the first visit, this is the subsequent visit. And you have the information that you already had prescribed pain relief medication to the patient. So, absolutely correct. All of you are correct that you would not be introducing yourself. So, you would have to have a name for this patient, which, as Gurleen ma'am had discussed earlier, you can either ask the interlocutor in the first 3 minutes on how they want to be addressed, or you can assume a name and start the conversation. Ask about the patient's current pain levels. So, we would not be introducing ourselves, so we could start the conversation by saying, "It's good to see you again, Kim." And now we have to ask about the patient's current pain levels. So we could rather than asking directly, "How are your current pain levels?" we could ask them, "How have you been feeling since your last visit?" Or, "Has the medicine that was prescribed last time been effective for you?" So the patient would automatically speak about the pain that they're experiencing or whether it has been effective for them or not. So let the patient verbalize their concerns. You should not be the one who would be, let's say, provoking the patient to verbalize their concern. Give them that free space so that they can verbalize their concern. So ask questions which can encourage them to speak more. Address the patient's concern about medication and suggest alternative pain management strategies. Physical therapy, low impact exercises, weight management, proper footwear, hot and cold compresses. In this case, do you see, is there any medical terminology which probably may need simplification? Yes, introduction is a part of the assessment criteria under the criterion of relationship building, how you introduce yourself, whether you're using the patient's name, whether introduction was necessary or not necessary, all of that is checked. So yes, your marks would be impacted. Okay. In the second task, do you think there is any word or phrase? Right. Kertena, absolutely correct. Physical therapy is what needs simplification. So we'll simplify. Physical therapy is a medical term, so I'll use probably exercises. And since I'm going to address the concerns of the patient, so when the patient, speaks about their concerns, I can paraphrase it, I can utilize in my conversation, I can feel sorry about them. I'm sorry that the medicine did not prove to be effective for you. It must have been difficult for you. And then whatever the patient has said, you can paraphrase it. And then when you're giving suggestions, let's talk about some options that can be useful. And since you're going to talk about options, you can use the technique of chunking and checking here. So break them into chunks, speak about each of them, and check whether the patient is okay with it. The next point talks about when asked, explain the criteria for surgery referral. So in this case, when asked is very important. Let the patient ask about the surgery, details of the surgery, and then you inform about the criteria of the surgery. Let's see how do we prepare for this. Um, any particular thoughts or concerns that you have related to the surgery? So you talk about the surgical plan, you tell the patient about it, and then explore if they have any problems related to it. And when the patient does share their concern, so you educate the patient about the importance of multifaceted approach to chronic pain. That it's not only surgery that can be useful, there are so many other things. And emphasize the benefits of conservative management over surgery. So you would advise the patient that there are other things that can be considered before the surgery is performed or before trying out surgery. So patient could be reluctant that I do want surgery. It's a quick solution. So you would have to be considerate. You would say that I know you want a quick relief from your condition, but let me tell you that there are many other ways in which your condition can be managed. Surgery is a valid option, but there are certain risks that are associated with. So you can talk about how other option and how conservative management can be more effective for the patient as compared to surgery. And here, since you're going to stress about the importance of or emphasize about the benefits of conservative management, so you can use the technique of labeling and you can stress that it is imperative that you try other methods before you go for surgery. And finally, schedule a follow-up to evaluate the patient's progress and response to non-surgical intervention. I'd like to hear your thoughts and ensure that you're comfortable. And this should be in consensus to the plan that you have suggested to the patient. So you can tell them, are there any particular approaches or is there any particular management that you are concerned about? Because the patient is asking about surgery, but you are telling them that there are other ways that they can, that their condition can be managed. So if you see, for every point, you already know or you already have anticipated how the patient is going to behave, how the patient is going to respond, what are the emotions of the patient that are going to be. So you in advance you prepare yourself and write these small little cues on your card so that when you are having the conversation during the 5 minutes of role play, you're not stuck, and these can be your guiding stones to have the conversation. All right. Now, before we wind up the session and having understood how to prepare for the role play, we would have a quick recap of what techniques we have learned. First, it is very important to anticipate the agenda, sorry, to understand the agenda of the conversation. The purpose of the conversation is what you need to be very careful about. You need to read the role play card, understand, and then anticipate what the patient might be feeling, what the patient might be expecting from you, what are the emotions of the patient that are going to be there, and then adapt your communication to that, the expectation of the patient. So all of this you have to read the case notes, understand and anticipate. Then, whatever the patient is expecting from you, according to your plan, you will have to deliver that, reading the tasks that are given on your role play. So, it is important that you be prepared on how you're going to introduce new information, how you're going to elicit the concerns of the patient and then address them. Be careful that you don't use medical terminology, and if you do use, check the knowledge of the patient and the familiarity of the patient with that particular about that particular phrase or word that you're going to talk about. And then it is important that you understand um, that you have 5 minutes to perform your role play. which task and make a tentative plan and have an idea on which task may require how much time, whether there's a particular task for which you'll have to devote a little more time as compared to the others, and accordingly prepare yourself so that you are able to have a communication which covers almost all the points during the 5 minutes of time. But again, let me restate this, that it's not important for you to complete all the tasks on your card in the 5 minutes of time, because this is not a criterion for which you'll be assessed. Completion of the tasks is not necessary. All right, I think we did give you a lot of information about preparation of the card, and I hope all these points, techniques, steps help you in preparing for your role play cards better. Do use these techniques in all the future role play cards preparation that you're going to do. Do use these when you're having the conversation with the patient in your real life, so that you are able to utilize it better in your OET role plays and hence score better. That would be all from Khaira Education today. Khaira Education, as you know, is Asia's first premium preparation provider. We provide courses to healthcare professionals in both online and offline mode. Gurleen Khaira, our course leader, as you all know, is a well-known name in the field of OET preparation. She's written multiple books. And if you want to join us, you can join us on a free Telegram group, or you can join our courses. You can contact us. When you join our courses, we have free giveaways for you. And these are the 3 books that we give away when you join Khaira Education for your preparation. I wish, and we, the whole team of Khaira Education, wishes all the very best to you for your preparation. And we know that you're all going to shine bright. Thank you very much. Have a great day, evening, and a good weekend ahead. Thank you very much. Bye-bye.